You're an expert in anatomy, so maybe you can talk about the link between good posture and proper arm use.
Yep, there's a lot of controversy out there in the literature, but if you want to look at some basic fundamental facts, what do we know? We know that your spine is the foundation and axis of movement for the rest of your body. So that means the position of your spine, if you're kyphotic and leaning over a little bit more like this, will have a direct impact on your ability to move your shoulder, and therefore the range of motion of your elbow and wrist and hand will all be limited by how far those can move. So when you're looking at basic movements, our goal actually, the reason our body moves is to allow us to acquire resources and escape from danger. So your goal when you're working should be to go ahead and cycle through all of these ranges. It's okay to slouch a little bit as long as you don't spend too much time there and come out of it. Just like trying to maintain a fully upright posture where you're like, well, this is how I always stand. It's not realistic, right? You're looking for mid-range, and then the exploration of the end ranges for that. So if you have good spinal mobility, it often leads to better functional outcomes for the upper extremity being usable as well.
One of the important things that I try to emphasize with my students and in my books is that you need to keep your muscles balanced. And in our society, everything is forward. People eat, they're driving, everything is in front of them. Their computers in front of them, their phones in front of them. And they wind up getting very short in their pec minors and very weak in their backs. And when I was studying anatomy, my teacher said, do 3 back extensions for every crunch. In other words, really work on this because we don't get enough of this in our daily life. We're not crawling on our bellies and looking up and scanning the environment the way, a lizard would or something like that.
Exactly, and it's not even so much that. How many of us are actually reaching down and picking something heavy up anymore? Most people are not doing that. That action would have been a fundamental thing, just reaching down, picking up something big, and then working on these back muscles. I have a couple of bodybuilder patients who hardly at all work their chest. They mostly spend their time working their backs because of such an imbalance that occurs. And the big kicker on this is the word contracture, which is permanent shortening of soft tissue. You can actually change it with stretching, but for right now, we'll call it permanent. If I spend a day, a week, a month, a year, 2 years, 5 years in this position, it becomes harder for me to get up and out of that position. So one of the major signs of aging and debilitation of the body is a loss of flexibility. Your goal is to maintain that flexibility and strength as long as possible.
What you just demonstrated was the evolutionary chart in reverse.
Yeah, absolutely.
It starts out here and then comes here and then comes, yes, exactly.
Yeah, exactly. We come into reverse, but guess where we are now? This is where everybody is. And we're devolving back into this.
Yes. No. It hurts me to watch you.
Okay.
But also what you did in profile there looked like a row to me. Your body is tilted forward, you're reaching, but you were placed. You weren't collapsing there. Your spine was long, as it should be in a proper row. And you were drawing something to you, but your shoulder blades were close to the ribs the way they're supposed to be when you're doing a proper row.
Yeah, one of the key things that I like to do for our patients is I'm big on functional movement patterns. And one of the best ways for you to develop good functional movement patterns is the simple practice of yoga. If you would do a vinyasa or anything, it will take you through all of those ranges to start with. It's a flexibility and strength training exercise at the same time.
They say in yoga, you're as young as your spine is flexible. Have you heard that?
Absolutely, I have, for sure. Yeah.
Yeah, well, you've written a book on yoga too. This man writes books on everything. So in terms of a general spinal strengthening program, I usually give things like cobra back extensions, shalabhasana, walking backward, flying, Superman, and those things for the smaller muscles of the back. And also for, I do things for the rhomboids, and that's fine. And I think it helps you because then instead of thinking about it, you've got the muscle tone. So instead of falling forward, the muscles are actually tightening so you can keep them in a relatively erect position and you don't have to work so hard at it. Yep. So a lot of people tell you they cannot sit without a backrest, and I never use a backrest unless I'm at the dentist.
Yeah, there you go. Yep, it always varies and depends on person to person, but at the end of the day, we're always looking for that balance of strength and flexibility. And I feel like what we're missing for a lot of people, even a deep squat is a good spinal range checker if you want someone to do that. What we're missing for a lot of people is the actions of something as simple as a deadlift. Now, you can't do this with extreme low back pain, but there's more and more research coming out that suggests if you can deadlift, you're going to see better functional outcomes. And we're talking about good alignment of the spine, nice and straight through, engaging through the hips, and then pulling up through the legs to develop good functional movement patterns here. And not enough people are doing something as simple as a deadlift, as simple as a squat.
Maybe you can demonstrate this thing that I'm always harping on. I'm going to turn sideways so you can see me. So here, if I'm slouching, I have no strength in my arm. I can't access the, the muscles that are involved in the scapular depression.
Absolutely. I had a patient like this last week. She suffered a cervical disc herniation, and it caused her to have to change her posture at work. She's a receptionist at a bank. And so the issue for her was exactly that. She had to slouch down like this to try and take some pressure off of her neck. We'll go the right way. She was moving this way. And her arm got stuck out in this position. Well, she has aching in her arm. She can barely move it back and forth because of this changing position and the associated nerve compression in her neck. So part of the treatment is getting her back and more upright into her neck to give a little bit of distraction. On a technical level, it actually opens up an intervertebral foramen and gives pressure off of the nerve. Would be one of the key things. But getting her back into this position right here and as neutral as possible, and then bringing her weight, her work closer to her midline. So she doesn't have to reach quite so far. She can stay more centered and then start to work out, and then eventually start to branch back out into those further movements that were there with a good foundational anchor to move from.
You just brought up two things that were notable to me. One was if you don't have good posture, it's also going to really affect your neck because all those muscles are holding that heavy head, which now weighs 60 pounds, 30 pounds. And the other thing that I've noticed as someone who does personal training and movement therapy, that, I give people strengthening a program for their back and the pain just disappears.
Yes.
And it's so interesting to me that people think of, they want to stretch, but that actually isn't what they need. What they need is the strength. And when they start doing that, the pain goes.
That is an excellent point, Deborah. Absolutely. In fact, if you're looking at the current research, and it's been like this for the last 15 years-ish or so, the vast majority of articles support strengthening over stretching. Now, I'm not saying don't stretch. Please don't misquote that. But if you can see increased strength, you see better functional outcomes, you see improvements in quality of life as well.
I was just reading an article about that questioned this whole concept of stretching. And yeah, flexibility is important, but I think that's different from stretching, which can actually make matters worse.
Yep.
So anyway, we're sort of running out of time here. Is there anything else you want to add about the spine-arm connection?
No, the only thing that I would add to it is, one of our new books that we're working on right now, if I just flash this up, you can go ahead and see the dangers of prolonged sitting, all right? The main goal here, even in a stand-up desk, all of these are going to make a difference in your activities of daily living. Even right now for this interview, I'm at a stand-up desk. Do I stand up all the time? Absolutely not. I'm sitting about 3/4 of the time to half the time, but I'm varying my position throughout the day. That fundamental movement will help your spine move better, and because the spine is the foundational anchor that your appendices, your limbs move around, it'll make your shoulder and arm movements better as well.
Thank you so much, Dr. Vizniak, for all of your wonderful information and for being so clear with the anatomy and the explanations. We really appreciate it here at RSI Help YouTube. So thanks everybody for watching. Please subscribe and we'll see you next time. This is Deborah Quilter signing off from RSI Help YouTube, and thank you so much, Dr. Vizniak, for coming to the show.
Thanks for having me.
Bye.